Again, welcome all to our CIGNAL All Grantees meeting, Change Ideas to Grow, Nurture, and Lift for Maternal and Child Health in Rural Communities. My name is Denisha Charles. I'm one of the project managers at the TA and Support Center. And I'll go ahead and turn it to Sharon to get us started for today.
Thanks, Denisha. My name is Sharon Gutu, and I'm also one of the project managers at the TA and Support Center. And I'm excited to have you all join the CIGNAL All Grantees webinar as we talk about challenges and strategies around maternal and child health in rural communities. Next slide. So for our agenda today, we will start with a welcome and introduction from the Healthy Start TA and Support Center. We'll then go over the overview, which are challenges around maternal and child health in rural communities. Then we will jump into main challenges connected to Healthy Start. We also have two presenters today who will go over how they're addressing maternal and child health in their rural communities. And this will be Jonah Wishmeyer from the Healthy Start Communities That Care and Alexis Northern from Missouri Booth Hill Regional Consortium, Inc. Then we'll go into the main strategies for Healthy Start, potential partnerships and resources, and next steps as we discuss themes and ideas to explore in the future. Next slide. So just a reminder, this session is being recorded. All participants are muted upon entry, and we ask that you remain muted to limit background noise. And participants are encouraged to share comments and ask questions using the chat box. After you join the Zoom session, an audio conference box may appear. If you do not see the box, click Join Audio. From the audio conference box, select Phone Call or Computer Audio. If accessing the session audio via phone, dial one of the given numbers next to dial. You will be prompted to enter the meeting ID. Then you will be prompted to enter the participant ID. If you can hear me now, then I think your audio is fine. To use the chat box, click the chat button at the bottom of the Zoom window. A sidebar will appear where you can chat to all participants. And to ensure that you're chatting to everyone, you can select the drop down at the bottom. I will now turn it over to Ken to do our welcome.
Thanks so much, Sharon. We go right to the next slide. And again, it's exciting to be here with the Healthy Start grantees to really focus on CIGNAL for maternal child health in rural communities. And the goal really is to enhance and strengthen the capacity of the grantee to identify and execute on strategies that really focus on improving and safe services in your rural communities. And many of you know Healthy Start started with this round and with an intentionality around focusing on rural communities. And that's why we have a good amount of Healthy Start grantees that are part of this cycle. And so this is a very important signal. We really appreciate you being here, and in addition to our guests to share today.
Great, thanks so much, Ken. I'll jump in and provide a little bit of background, if that works, in terms of these signals and what we've done so far and what we're focusing on today. So we'll go to the next slide. So we have, as Ken was just saying, the intentionality behind this round and having a fourth of the Healthy Start grantees really be in rural communities. And so as you can see on our map here, there are 24 Healthy Start grantees across the country that classify themselves as a rural site. Next slide. And so in these signals, as we've said, we've kind of had two before, and this is our third signal. The ones in the past have focused on subjects such as perinatal mental health and behavioral health, as well as maternal mortality and morbidity. And so this one is focused specifically on rural communities, as we were hearing from more grantees from rural communities and kind of really wanting a space to really talk more about the specific challenges for this geographic area and some of those real strategies for change, right? Things that different sites are testing out in terms of those unique challenges. And so for the signals are set up as a two-part series. The first part is really an expert meeting. And as you can see here, the goals for that expert meeting are really to identify and explore potential change ideas related to MCH for rural communities, describe challenges in rural communities, and brainstorm steps that programs, Healthy Start programs, can take to assure improved and equitable MCH services in their communities in the future. And as we go to the next slide, to give a little bit more information about that expert meeting and what we focused on. So you can see here the different questions that we asked experts to really weigh in on. And a lot of these, again, connect to better understanding and getting to the nuance, right? We hear a lot about challenges for rural communities. We hear about transportation. We hear about these big, broad categories, but really getting into the nitty gritty, better understanding the nuances for each community, right? And we heard conflicting information out there because we know each community is really unique, and that, you know, rural doesn't mean that everything is the same for those grantees. And we'll move to the next slide and just giving you a sense of the different folks that were in the room in that expert meeting. So we had project directors, some of whom you will hear today, and really thank them for bringing the on-the-ground insight into these meetings. We also had researchers, folks who were running programs focused on MCH or somewhat other topics kind of in the rural space, and other folks who have really a depth in resources and kind of building collaborations between partners. And next slide. So as we kind of wrapped up, we had that meeting about a month ago or so, kind of pulled all of the great feedback that we got, the recommendations, kind of challenges, solutions, pulled that content together to be able to share with you all today. And so that's where we find ourselves as this second part for the webinar for all grantees. And our goals with you today are really to discuss and share the information that we heard from those experts on the key issues and strategies around MCH in rural communities, to highlight stories from Healthy Start grantees. So you'll be hearing 2 different grantee sites talk about their work, and then provide you all with resources and tools for testing these strategies in your own communities. And today's a little bit of a more intimate group. So really hoping that folks will engage with us and share your experiences as well, to deepen and enrich in kind of the conversation that we've already been having. Next slide. So on that vein, want to kind of see who else is in the room, hear from you all about some of the challenges that you've been facing. So I will open it up to the group. Please feel free to add in the chat the answers to these questions. So the things that we're kind of throwing out here to get us started. What did you know about the challenges the communities you serve were facing before COVID? What do you know or have learned about challenges in the communities you serve since COVID? And what new challenges do you need to address for the future? So I'll pause here. Again, welcome folks to add things to the chat or come off mute.
Nikki, I think since we're such a smaller group too, really want to encourage you to feel free to come off mute and share in the space.
I know we are catching folks at lunchtime, so I'm guessing that some of you probably have lunch in front of you and don't want to come off mute. But we'll give you just a few more seconds here. We can always circle back to this as we kind of get going into the rest of the content, but would love to hear from anyone if they would like to share.
Okay, and while we're waiting too, I'll just share, because I've kind of been doing my own little, I don't know, just exploration of colleagues around the country that live in rural communities and just in other spaces of work that I do. And just some of my friends have even commented on what their community, the vibe in their communities in those rural places, just when they go into grocery stores, kind of what they're observing around them when it comes to seeing families out in the community. So if any of you have any insights that you could share there, because I think within the Healthy Start community, one thing that I know the division wants to learn more about, and really what is the experience in the rural communities. And so I think sharing that among all the Healthy Start community is really helpful. So people are really aware of really what is it like, and because a lot of folks comment again, just on what they saw, even as they're going about their daily business in their communities, just seeing a difference since COVID has come. So any thoughts there would be helpful too.
Hi,
I think kind of some.
Go ahead.
Go ahead.
I think something that we're kind of seeing down in Missouri in the Boot Hill is that we're wanting to get out and do community activities, but we still have that small hesitant people that are still kind of hesitant about coming and joining groups. So it's kind of like an in-between area that is kind of hard to address.
We've experienced the same. I will share something that came up during the March 23rd, I think it was, CIGNAL meeting. But one thing we've experienced, and I don't provide any direct care. All of us through IRHA, myself, and then I know that Kasha's on here, our data coordinator, we just lead and manage the program. Our direct clinical care is provided by our perinatal navigators, community health workers, and providers. So we hear a lot of feedback from them. And one thing I know that was a little bit eye-opening for us, even though you feel like you kind of know it, but then when you really hear them say when, COVID was at its peak and when visitors were limited, when they could meet with their participants, our Healthy Start staff, but they could not have maybe their spouse or their significant other with them because of COVID guidelines. A lot of information came out, unfortunately, on IPV, the intimate partner violence. With this said, I think we kind of changed a little bit of some things that we were doing. And, it was just that safe place for the moms to come in. Hopefully they always feel that it's a safe place, but without their spouse, more things came out. So just, being aware of that. I know something else that we tried to do when we, a lot of things became virtual. We really still tried to have them lay their eyes on their participants. Maybe they couldn't, go into their home, but, could they FaceTime? Could they do something virtual with video so they could at least assess the space and just really lay eyes on the environment to pick up on any clues if anything was going on. So that's definitely something that we've learned through the COVID challenge.
Thanks so much, Jonah and Alexis. Anyone else before we move on? Okay, all right, well, I hope that you're eating your lunches, thinking about these things, getting comfortable with us, because we're going to have a few more engagement opportunities as we move forward. But we can go to the next slide. So Ken, I think I'm turning it over to you to give us a little bit of an overview of the challenges around MCH in rural communities as we get started.
Yeah, absolutely. Go right to the next slide. So we wanted to really ground our conversation, and we used this quote before from John McKnight and Peter Block. John McKnight has done a lot of work around the country over the last almost 3 decades of just working in community and thinking about assets. And he's famous for his asset-based community development. And Peter Block is known for his work around just talking about community and sense of belonging. So I wanted to start with this. We need our neighbors and community to stay healthy, produce jobs, raise our children, and care for those on the margin. Institutions and professional services have reached their limit of their ability to help us. The consumer society tells us that we are insufficient and that we must purchase what we need from specialists and systems outside the community. We have become consumers and clients, not citizens and neighbors. And we know the stories that are in all communities, and especially in rural communities, the stories are so important. The connections that communities are able to make during tough times, during good times, are so important. And so again, the conversation today, how do we take care of our community and those within it, especially our women and our children and those that are most vulnerable? So we wanted to start with that as we get into this conversation. Next slide. And so when we think about the background, we know in this country, over 60 million people live in rural America. And rural communities lack access to high quality maternal health services. And that leads to problems like premature birth, low birth weight, maternal mortality, and severe maternal morbidity, and that increased risk of postpartum depression. Since January 2010, more than 100 rural hospitals have closed, and we've learned that that's still happening. And also between 2004 and 2014, 179 counties experienced closures and loss of hospital obstetric services. And that's not even talking about the challenges even within those systems when they are in place. Next slide. So, Denisha, Sharon, want to tell folks about the poll and then we'll engage them a little bit?
Sure. So I'm putting some instructions right in the chat for you all to participate in this poll. We'd love you all to either visit that URL, so pollev.com/healthystart428, or you can text healthystart428 to the numbers 22333 to respond to this question. So all you need to do is go ahead and click either on that link or text 22333 to healthystart428 to respond to this question. You can respond more than once, and we're asking, what are the key challenges your Healthy Start project is facing around supporting maternal and child health in rural communities? So as you all are actively typing in your responses, you'll see them populate right on the screen. If you have any questions, please feel free to chat me.
Folks should feel free to use the chat as well if you don't want to do the poll everywhere. Oh, there we go.
Okay.
I would love to hear more from the person who put in participation and hear a little bit more about the nuances there, if you'd be willing to share. So I know these are going to keep scrolling down as we do this, but definitely we've seen transportation up there twice, access to care, availability of mental and behavioral health providers and experts, participation. These resonating with folks? Continuity of care. Yep. Okay, we'll give it a few more seconds here. I think that as we get into sharing with you, the next section will be sharing with you the challenges that during the expert meeting we discussed. And I think a lot of these, all of these are really going to connect with those themes that we've pulled out. Okay, all right, well, we'll move on to the next section. But if folks have other challenges, feel free to add them to the chat as we go through. So yeah, in this next section, we're really going to share with you what we heard and what the group discussed. Next slide, please. So we're jumping right in here. You'll see that we've pulled these out as a number of different themes. In no way do we feel like this is, comprehensive and includes everything, but these really were the main themes that bubbled up from the conversation. And so no surprise probably to folks here, transportation came up as one of those large themes. So the lack of transportation and enduring long travel, driving distances to receive healthcare. I think that we're also going to hear from some of our grantees about this when they present as well. But anything else, Ken, you'd like to add on this one before we move to the next?
Nope, I think you're good on that. I agree.
Okay. So we'll go to the next slide.
So here we see just limited healthcare providers in rural areas due to the lack of recruitment and retention. So again, we heard this also come up during the poll, but that limited access to the providers due to the recruitment and retention, not getting those kind of providers in the area to really provide service to those in the community. Another key challenge.
Great. And we'll go to the next one. And this one we already really hit on when we were talking about some of those stats earlier up, and just the lack of access to prenatal and maternal care in particular due to OB unit closures in hospitals in a lot of rural communities. The next challenge.
Another key challenge is just the low quality healthcare due to inequitable systems. And there we're talking about limited health insurance coverage, limited or lack of access to basic healthcare service, and then think about all the other services that are needed to be part of the engagement of services. So again, that low quality healthcare due to the inequitable system all around, another challenge. Next one.
Yeah, and so this one, in terms of community members not having access to co-location of services, we've really heard a lot about that. And then also focusing on the mental and behavioral health services, thinking about those co-location. And some of the things that we heard in the expert meeting were folks talking about just needing additional emotional support and behavioral mental health specialists, and especially because it's heightened in rural communities because of some underreporting, right? And we actually heard one expert share with us that when they were working with clients, clients were more willing in some instances during the pandemic when they were meeting virtually or just kind of the topic of behavioral mental health was more, lifted up in that time, hearing more about folks reporting domestic violence or other traumatic events. So that certainly came up in our discussion as well.
Yeah, and I know during that conversation, they also, when they were emphasizing this idea of co-location of services, so if people are making the effort to come out, how important and critical it is sometimes to have other services available in that same location, because people may not come back out again due to some of the challenges.
Absolutely.
The engaging part of the conversation. Let's go to the next slide. We've got another key challenge. And so trust and connectedness between healthcare providers and community members has been eroded. And as we all know, excuse me, in this work, it's always been an issue, this establishing trust, but this trust that was kind of established was kind of eroded during this time too. And so that kind of sets a community back. And that's what we heard during this conversation with these experts too, that trust and connectedness was just really compromised. And in some cases just doesn't exist anymore now because of the way things kind of played out under the pandemic. So that was pretty critical as well.
And as we move into the next one, this one, I'm sure everyone's thought this in terms of the pandemic, right? We know this, those at the margins of care really just fell off during the pandemic, right? So those folks who were on the margins really were the most impacted by a lot of things in COVID. And so there just has been a disconnect with a number of folks in terms of providing services or connecting them into the system.
Yeah, and I would just say the piece that I always add to that too, you imagine people falling off the edge. That we have a lot of people right now, the last 24 months have been in what we call free fall because there's been no safety net or safety system to hold them. And so they're literally in free fall, and some because no safety net have literally hit the bottom. And so when we talk about moving forward and recovery from it, it's really daunting to think about the kind of the needs that are present and what we need to do to kind of really help people even recover. And then it goes into this key challenge number 9, which is just looking at virtual care. Virtual care was established during the pandemic, but the question that we heard from the experts is really, is it enough for, to be accessible to everyone? Because again, there are issues with getting everything virtually. Not everyone has access. And so again, that's another area we need to really explore as we think about moving forward and how do you get beyond and how do we provide virtual care in a way that is accessible to everyone, because it's not always the case. Okay, next slide.
And so I think that really rounds out our challenges. So we will kind of pause before we move into these case studies. I know at the beginning we were asking you all about challenges, but feel free to add anything to the chat or come off mute if there's anything that stuck out to you or you have questions for us about any of those challenges that we raised up. Okay, all right, then we'll keep going. So really thrilled to have 2 Healthy Start projects here to speak with you all and share a little bit about their experiences working in rural communities. So we have first Jonah Wishmeyer from the Healthy Start Communities That Care. And then right after Jonah, we'll transition to Alexis Northern from Missouri Booth Hill Regional Consortium. So Jonah, I will turn it over to you to get us started.
All right, thank you, Nikki. So again, I'm Jonah Wishmeyer. I am the project director for Healthy Start Communities That Care, and we are through the Indiana Rural Health Association. We are a new grantee, and we received the Healthy Start Initiative funding through HRSA April 1st, 2019. So I do want to mention before we start that our name, the acronym CARE, just kind of stems from case management, because we know we do a lot of that. Case management, access, referrals and resources, and education. So we feel like that CARE acronym kind of captures a lot of what we do day to day. And again, those of us at IRHA don't provide the direct patient care. We have PNs, CHWs, and then our providers, as we did receive the supplemental funding a few months following the initiation of Healthy Start that do provide that care. I do want to also mention in regards to the rural areas that we serve, we are in 4 counties in rural Indiana. We cover Davies, DuBois, Greene, and Martin County. And with that said, Martin County is an OB desert. So we are very familiar with, no services really offered at all in a county, and they report primarily to our DuBois County site. So within our 4 counties that we serve, we have 3 main hospitals. They're all locally owned hospitals. We have Davies Community Hospital, Memorial Hospital and Healthcare Center, and then Greene County General Hospital. So we're going to talk just a little bit. I felt most comfortable speaking in our program, specifically just the access to mental and behavioral health services for our group. So you can go ahead to the next slide, please. Okay, so all of you that are here are very familiar with Healthy Start, very familiar with the Healthy Start data collection forms. So I thought that was a good place to start, just to say, that is that initiation and that discussion piece that really starts addressing and assessing mental and behavioral health for our Healthy Start participants. So once, we do our recruitment and our enrollment, that first background information form really starts asking them about their mental behavioral health. It's addressed very specifically with some scoring, as you all know, and then some options of if they scored this, what have we basically, discussed or information we've provided to our participants. And then as you go along with your participant throughout their pregnancy or whatever stage they're in, you continue to address their mental and behavioral health through those data collection forms as we should. So with that said, we do that initial assessment, or at any point in that assessment, maybe it changes. So at any point that our PNs or CHWs who do that initial piece, or if it goes on to a provider, it's readdressed, but that PN and CHW, when they do that initial assessment, depending on scoring, of course, dependent on if the participant consents to be referred, we have an automatic referral process set up in REDCap. So we do all of our documentation through REDCap. I'm not sure if you're familiar with that or not, but that's the documentation system we use. And it has served really, really well for our referral piece. So our PN and CHW notice that assessment wise, they've scored high enough, or maybe just their clinical expertise lets them know, they would benefit from a referral to a provider. As long as they have consent, they check a box in REDCap, which then sends a referral to the provider. It also sends the provider an email. So if the provider doesn't see the referral right away, maybe they're on their email, they get that notification on their email that lets them know they have a new patient, that has been referred to them. So I know, I think it was Nikki, you mentioned in your presentation a little bit ago that co-location of mental and behavioral health providers. So when we first received the supplemental funding, we were very focused on a nurse practitioner or someone to really address those physical needs at risk and high risk moms and those physical needs that they would need throughout their pregnancy and their journey. but we did have one hospital who really wanted to go with that LCSW. And wow, are we glad we did exactly that. We've had an LCSW who really takes the bulk of our at-risk and high-risk moms, because we have found that a lot of our at-risk and high-risk moms that screen to be referred to a provider need that LCSW. They've screened high for mental and behavioral health needs, not so much those physical needs. So with that said, unfortunately, we had an LCSW resign. So I put in the chat a few minutes ago about availability of providers. It's been a struggle that you don't find a lot of LSWs or LCSWs out there. We have hired another LSW to cover participants in that county that we did have the LCSW. So we're very thankful for that. And she had a patient load or a caseload waiting on her for when she could really get on her own and start. And then we're excited to say that we have another partner hospital getting ready to hire, or actually has hired another LSW, but they don't start until next month. So really trying to fill the gaps there, because that's where the need is. Rural communities are not, I think it's all across the board, but we feel very fortunate in that. So having that co-location, having the Healthy Start provider that can provide those services part of your team is so crucial and really helps to provide the best care. So you can go to the next slide. So speaking of barriers and some solutions to those barriers, of course, we don't have all the solutions that we want. A huge barrier is transportation. I know that comes up all the time. And, through our CAN, we have been running our CAN for several years now, and we did an initial poll in a sense to see, across our 4 counties, what is the highest need? And transportation rose to the top, continues to do so. But it's really hard, as many of you I'm sure can relate, in rural communities to find a bus, to find a public transportation system that meets your needs. An example I'll share is, we have a lot of factory workers in our communities that work night shift, or maybe that's their second job. Those buses are an 8 to 4. They don't get transportation for that, late second shift to get back home, or third shift. So transportation is huge, and it is still a need, definitely. But when we really focused on just, that maternal, infant, child health piece of what can we do to make sure that, there's better transportation, maybe safer transportation, we really tried to think outside the box. And I feel like that we did. With that said, we have a lot of moms that have children, stair-step children. They are at a doctor's appointment for one child, but they have 3 or 4 others that either cannot walk yet, that they, have to hold their hand crossing the street. A lot of the moms live close enough that they can walk to and from their appointments or to and from the grocery store, those needs that we need for everyday living. So we thought, what can we do? Well, strollers came to mind. If we can provide the moms some strollers to put a few of their children in, whether it's a single stroller, maybe we do an assessment and maybe they need a double stroller, to really just make sure that the family unit going to those appointments, going to the grocery stores, are traveling safe. So I think that's something that you're going to see more specific to the rural communities. So we've just thought outside the box. We do not have the answers for transportation and making sure dad makes it to third shift and back home. And all of those things, we're still working on those. They're an active part of our CAN discussions, but the strollers, car seats, those kind of things can make a big difference. Insurance coverage, we work very closely with CKC Indiana, which is connecting kids to coverage specific to Indiana. They are also funded, their grant funded program through the Indiana Rural Health Association. But we really have a connection with them and can refer to them if we have a mom or really a child, anyone who is in need of insurance. They can assist with even just filling out the paperwork. Maybe the mom doesn't even know how to fill out the paperwork. They can assist with that for presumptive eligibility, emergency Medicaid, all of those things to help with that access to care, again, to try to get them some insurance coverage. Culture and language barriers. They're huge for us, and they are becoming more and more. In one of our counties, Daviess County, the Haitian population is really the majority of our participants at this time. And it's really hard to communicate with them. We don't have anyone that speaks Haitian Creole to be able to communicate with this group. And they can use hospital translation lines, but we have provided them and supported them with language line solutions. While it's not a perfect answer, it definitely has helped with handouts, marketing, education. Everything can get translated into Haitian Creole. They also have an audio and then a video on demand. So our PNs and CHWs or providers can sit with their participant, call into this number, and actually see the person translating for them. While there's still kinks that we're working out, and there always will be, that has been a great help. That also helps when they go in the home. You know, as long as they have internet access, which is another barrier, they're able to connect with the translators just to really help with that education and just that access to care. You know, questions like, you know, when do I need to come back? When is my next appointment? Simple things like that, or that seem simple to us, are not when they don't speak the same language. So really implementing language line solutions has really helped. And that's been something more recent that we have done. So immigrants and undocumented participants, I've kind of spoke on them. Internet access, I spoke a little bit on that. I recently learned a couple weeks ago of some opportunities in Indiana for internet access and ensuring broadband around our area. So I'm going to be looking into that in the near future. And just limited resources, I think, that we all experience in rural communities. You have to travel, and then there's that transportation barrier to get to the next hospital for that higher level of care. I think we all experience that. To really help with access to care, you know, home visits are huge. Can we go into the homes? You know, that helps that barrier right there. Maybe they don't have the transportation to come see us, but can we provide services to them in the home? So we have some of our PNs and CHWs that do quite a few home visits. And then the collaboration with community organizations. You know, we have a lot of mental and behavioral health issues in our communities. If our LSW or LCSW, they feel that the care a participant needs is out of their scope of practice, we always, you know, tell them to, you know, communicate with the participant, let them know that they need further care. It's outside of Healthy Start, so additional fees are going to go back into the healthcare system, where those fees and insurance and all that really come back into place. But just making sure we have communication and relationships with different organizations like Fresh Start Recovery Centers or Brentwood, I think it's Brentwood Springs, that really can take care of inpatient, outpatient, emergency mental and behavioral health services, and just that open communication. And then as you see IRHA Help on here, we can go ahead and go to the next slide. IRHA Help is a tool that the Indiana Rural Health Association has really started working with. It's powered by Find Help. So if you're familiar with what they used to call Aunt Bertha, which is now Find Help, this has been a tool that we are working more and more and integrating more into our hospital, the PNs and CHWs, and the work that they do with our participants. It really comes into play for any referrals that we really don't feel that we can take care of with our own Healthy Start program or our hospital systems. Anything listed on here is free or reduced cost. It has to be a direct social service, which is typically what we're looking for. It is very easy to use. It's a referral process for those facing any kind of social needs. We can help find a referral point for them. We can help with scheduling using this site. The wonderful thing is it's available in 100+ languages. So with that said, we'll just use our population out of Daviess County, the Haitian population, we can translate the website into Haitian Creole. Now I would have a hard time following where I was at on there, but that's what they can read and understand. And you can actually print information out for them off of IRHA Help that is in Haitian Creole. And it can help with a multitude of things, from addressing food insecurities, housing, transportation, financial assistance. An example is, if you have a diabetic patient that really needs help with meal preparation, maybe delivery of meals. A lot of times you can find that right in this online resource. So you can go to the next slide. So this is what the IRHA Help site looks like. I don't know if there's anyone else from Indiana on here, but this is really focused on Hoosiers and those in Indiana. This database under IRHA Help is really a lot of Indiana resources. However, Find Help feeds right into this. So you can find all kinds of information on this site. But if anyone on here is from Indiana, I would encourage you to go through this site, the IRHA Help versus Find Help, because it will help just track the needs of Hoosiers more so to your local area rather than looking at the whole nationwide Find Help site. But either way, you can definitely get some assistance for your participants using these sites. And the IRHA Help one is irhahelp.indianaruralhealth.org. And you can go, I think, to the final slide. So if you have any questions, want to chat about anything or want to contact me, my information is right here and I can hopefully help. If not, I will find the answers for you, hopefully. So that's all I have. Probably longer than 5 minutes, so I apologize.
Not at all. Thank you so much, Jonah, for all of those strategies, resources. I think that was full of things for grantees to think about and to take with them. So folks, if you have questions for Jonah, feel free to add them into the chat. We can definitely keep an eye on that as we continue through, but really excited to have our next speaker join us, and Alexis Northern. I'm happy to welcome you to the meeting and excited to hear your presentation. Oh, Alexis, I think that you are on mute and your video just got turned off.
Yeah, I'm here now. Can you hear me?
Great. Yep.
Okay. Okay. Hi. Good afternoon. I'm Alexis Northern with MBRC, and I am our new health educator. And today I'm going to be talking about the understanding of vaccination hesitancy in our Missouri Boot Hill Healthy Start program. Next slide, please. We as an organization have really been addressing racial disparities in health outcomes. We have currently been working to improve child and maternal health outcomes as it relates to COVID-19. The purpose of this study was to understand and gain knowledge of why pregnant and prenatal or postnatal women were hesitant to get the vaccine within our Boot Hill counties. Next slide, please. From our funding with HRSA, we were able to give mileage, childcare, transportation reimbursement, as well as gift card incentives for their participation. We created focus groups for some of the pregnant women within our Boot Hill counties. Our Boot Hill counties are Dunklin, Mississippi, New Madrid, Pemiscot, and Scott County. 5 of the counties in our service area were represented in the focus group. However, our Pemiscot County was not represented. Our focus group was conducted in a hybrid technique, which we used virtual meetings, and we also hosted a few on-site meetings at MBRC using social distance protocols. Next slide, please. So during this study, we observed that 3 things stood out to us: that mistrust played a huge role in our vaccination hesitancy. Just not having the correct information given to our clients was a big thing for most of them. And social media was shown to be the biggest platform for both positive and negative information. So we used our Facebook to promote outreach and education. And lastly, racial disparities in how the information was provided. For example, one of our participants who was white expressed that her OB shared information about the virus and the vaccine and explained to her exactly how it would work and how it would affect her and her child. And on the other hand, our other participants said that they were provided superficial information, such as everyone would eventually get it, take the vaccine when you can, and it's probably best for you and the baby, but didn't give actual information to the client or patient about how it would affect them. So that really relates with the mistrust, because people don't see that they're getting the correct information. They feel dismissed. Next slide, please. So our insight on this, we have created myth and fact sheets. We have created brochures, flyers, and PowerPoints to really work with and network with our CHWs and our local health departments and pharmacists. We have created, recently we just finished a podcast with 2 of our local couples, and they shared their experience with COVID-19. And I believe that both of them were on the ventilator. So it's a very touching story, and it's local, so it really impacts our area. We have also, throughout our education and outreach, we have vaccinated about 2,147 people. That includes the first shot, second, and booster. And that's ranging from men, women, and children ages 5 and up. And that's all I have for you guys. So if you have any questions, I will do my best to answer them. And if I don't have the answer, I can get back to you.
Thank you so much, Alexis. It was really exciting to hear about all of the work that you're doing around COVID-19. And I know that seen some of the reports that you all have put out, and just really impressive work.
One thing I can kind of touch on is we also have a COVID grant that we have been posting, doing a lot of outreach and education, and also hosting vaccination clinics. So this kind of pairs with our Healthy Start, but we're doing a lot more than just within the Healthy Start as well.
That's amazing. Thanks for sharing that. It's really amazing to see how your Healthy Start has really broadened its reach in terms of providing all of these additional services given the pandemic. Well, thank you, Jonah. Thank you, Alexis, for those stories. Folks, if you have any questions for the speakers, please add them to the chat, and we'll kind of keep moving here and jump into more of the strategies. As we shift away from the challenges we talked about earlier, we want to hear more about what are the strategies? What have you tried to address some of these challenges that we've been talking about? So again, we're going to put up a poll everywhere. So same instructions as before. You can respond at pollev.com/healthystart428 or text healthystart428 to 22333, as you can see on your screen. And we want to hear about what strategies your Healthy Start project is using to support maternal and child health in rural communities. So feel free to throw them in there. If that's too daunting, also use the chat or come off mute. Jonah, I was thinking about some of the strategies you shared earlier. So really thinking that example you shared earlier about the strollers has really stuck with me since the expert meeting. I think you shared that too. And before, and I think other folks have talked about different ways that they've approached that transportation and how it really is unique, right, for each community, about whether it's strollers or it's bus passes or it's creating some other type of transportation that doesn't already exist there. So that was one that really stuck with me.
Yeah, Nikki, I think from Alexis's presentation, what they're doing in Missouri, I think this whole idea of getting information out there, so developing those brochures or materials that can be shared in the community, doing those sessions to educate people on vaccination, those are really important strategies for us engagement. But I think I love the printed materials and creating things that can be shared in the community, because that's the best way to kind of get it all across the community, is having folks share it themselves.
Yeah, great. So seeing things in here about documentation to automatically refer at-risk moms to providers, partnership with mobile clinics. Yep, we haven't really talked much about mobile clinics, but that one as well. And I think, Jonah, you were also speaking, one of the strategies that I was thinking about in your presentation was about really reassessing kind of the staff that you had on board to meet different things, right? So kind of adapting that role to be what you really needed at the moment, right? Not necessarily what you had originally written into your grant. Collaboration with insurance navigators to assist in insurance coverage. Yeah, definitely. Anything else that folks have tried or thought about trying? All right. Well, we'll go in similar to what we did before. We'll kind of share with you what we heard from that expert meeting, and then we can circle back to discuss a bit more together. So Ken, I'll turn it over to you to get us started in this section.
Yeah, absolutely. So again, some key strategies that we heard, want to share, just to really discuss with you. Let's go to the next slide and get right into those. So one strategy was rebuilding the trust. We talked about, again, how it was eroded, but rebuilding trust and connectedness between community members and the health care professionals. And how do you even do that? And where do you start when it comes to rebuilding trust and connectedness? So I just want to spend a few minutes on that strategy, just your thoughts and ideas around that. How do we rebuild this trust between members of the community and the health professional? Any thoughts? So I'll share one strategy that I've heard that folks use, and that is when sometimes it starts out just a small community, 1, 2, or 3 providers that actually come together to do what's kind of been described a little bit in Missouri, Boot Hill, and that is really having information sessions. So really carving out time and inviting community members to come by and ask questions. So I've seen that in the hospital setting where, a group of providers have just provided time to just be there and invite community members to come in to ask questions. And some then have taken it a step further and actually into the community. I know at health centers, they're able to kind of do that since they're right in the middle of the neighborhoods, really literally just going out and just really trying to have those touch points with communities. So those are some things I've heard, just trying to reestablish connection and understanding. But any other thoughts that you all may have? John, I know your workers are out there, so other thoughts, ideas about how to really reconnect and rebuild trust.
Ken, I think another one we heard in the expert meeting, and I think this connects to this theme as well as some of the others, but one of the experts was really talking about recruiting young professionals from the communities to be trained as medical providers, right? And so having that pipeline, really investing in that so that when those providers are coming back to the community, they're very steeped in the culture and the values and already are part of the community.
Mm-hmm. Yeah, that's one of the best ones. Having folks that are connected to the community already come back, and then sustaining and supporting them. I think that was the other issue that came up connected to that. How do if they do come back, how do we keep them there? Because sometimes they can't be sustained once they've come back.
Right.
Anyone else? Any thoughts on this?
I'll just mention through the CAN and just other different coalitions, when you have a lot of the healthcare professionals on these, but also community members are invited or involved, and they can be part of the discussions and solutions.
Mhm.
Jonah, and I feel like that is a great tie into our next strategy, I think, that's in here, which really is encouraging community engagement in which stakeholders become decision makers, right? So really shifting that power and putting it in the hands of the people in the community, right? And I think the CAN is absolutely a platform for that, right? So Ken or Jonah, anything else you'd add here in terms of this strategy?
Yeah, and I think this is important. And again, thank you, Jonah, for bringing up the CAN, because again, historically with Healthy Start, I think 30 years ago, one of the hallmarks of this program was that it had this community action network as an arm of these grants, which is the first time in the country that there was an emphasis on engaging community, the stakeholders involved in the issues themselves. And so again, 30 years of this, it's really continued to be that proven strategy. One of the best things to do is to utilize your CAN to engage both community stakeholders as well as providers and a diverse group of folks to really have the kind of conversations and to negotiate, as you said, really shifting that power. And I think it's such a great opportunity now when everything has been so messed up because of a pandemic, especially. It's a good opportunity to come back to the table and start having some of those conversations now. But the community action networks, which all 101 Healthy Starts have, as I think one of its strengths, but I really believe in the community engagement aspect and working with people impacted by the problems, because there are solutions there that others don't think about, but CAN provides that space to kind of hear about those things and then put resources to support some different types of action. Yeah. John, I don't know if you have, or Alexis, based on your CAN work, anything to add to that, but I think it's a powerful engagement piece.
I think just those things that we have seen within our vaccination clinics, like we really try to get local churches involved and people to help do the vaccination clinics, different people to host them. So then you're reaching more of the community as a community instead of at the health department or at the doctor's office. You're making them feel like they are involved in it, and it really does help that trust and engagement aspect of it.
Yeah. Another question I would ask that inspires another thought, Alexis, but the rest of you that are on the call, Norman, Luke, Sarah, Melanie, the others, think about that behavior and mental health aspect. Because again, one thing that I know we hear in general with communities that are dealing with distressed communities, they're just tired. And so this pandemic has made them, I'm just too tired. And you actually hear, I'm just too tired. I'm through. I trusted you before. Now this is happening. So when people are at that exhausted point where I don't want to engage, have you all had any experiences you're working with your clients, those that you had engaged? What kind of things are you hearing with regards to, is there any energy to even want to engage more? Because again, when this leaves, people are just tired and they're sick and tired of being sick and tired, as you've heard that saying before. So any thoughts on that, just your experience in working with clients and community, what makes it even more challenging than to kind of engage them if they're just too tired of them through? Anyone have any thoughts on that?
I know we have 2 semi-big events coming up. So we're having a big Mother's Day event on May 5th. And we're also having a big event here in our parking lot at MBRC for Medicaid expansion, and we're calling it a Family Fun Day. So just encouraging the community to try to get out and be involved in something is just kind of our way to just re-energize them. Just give them that encouragement that we're here, we're doing stuff still, and to be involved.
That's great.
Great. Let's move on to the next strategy. Yeah, so revising how programs are structured and ensuring they're relevant to what the communities need. This is a big strategy, right? So I don't know if anyone else on the call has some examples. Ken, Jonah, Alexis, anybody here in terms of how do you actually do that, right? Yeah, turn it over to you all.
I can speak to this for a moment and mentioned it also in my presentation. But, we realized pretty immediately that, we had, for our provider standpoint for Healthy Start, 2 nurse practitioners in place and 1 LCSW. And we realized right away, and one of our hospitals even said to us, if for some reason, this NP doesn't work out, or, she finds a different job, whatever the case is, like, we are very interested in filling that provider with an LSW or LCSW, because the mental behavioral health need is so pertinent here. And we really need that piece at our hospital. So that is the hospital that they have recently hired one, and she actually begins in May. So, I talked to my project officer about it, making sure that it wouldn't affect any, of our participants or numbers or anything like that. And I'm like, this is only going to help and increase participation just because the need is huge.
Yeah, thank you for that, John, because I think you bring up a great point. That's an encouragement for the rest of the folks on the call today, is that this idea of working with your project officer, because again, we see the commitment from the Bureau and the division to really support all Healthy Start, but especially those in these rural communities. And so this strategy really speaks to being innovative and pivoting during this time and having room to do that. And sometimes there are barriers, policy barriers, et cetera. But again, talking with your project officer to talk about ideas, things that you see need to change or you need to shift, and getting that support from the division is really important, because they've been very supportive over these last 24 months with regards to a need for innovation. And so when you all have the best purview on what's needed, and so sharing those ideas, I think, with your project officer, if you need to kind of move funds or shift, I think it's an important thing to do, because again, they're very supportive. So I think that's important connected to this, because there's some of the barriers presented because of how things are structured may need to change in this moment. And you certainly can get support to do some of that through the division.
And Ken, I'm thinking back up to our opening questions about COVID, and COVID, right, forced everyone to be innovative and look at this, right, in terms of how they were providing services. You didn't have another option, right? Like, you couldn't meet with people in person, so you had to reassess. So I think it'll be really interesting as we continue to, sort through where we're coming out of this pandemic, and what those services and structures could be looking like.
Yeah, and the more our rural sites can share with their project office, with the division, not only through your regular reporting that you do, your annual reporting, but just really sharing with them some of the nuances that you all know you're experiencing, because I know that's what they're really interested in. And that's one of the reasons they leaned into making sure they fund more rural sites, because they want to learn what's needed, so that again, as they move into this, even the next cycle of Healthy Start, they'll be able to be more specific when it comes to the work that needs to happen in those communities. So again, just to emphasize, that commitment is there, but they don't know unless you share with them. It's the same with our fatherhood work. If they don't know the challenges that people are having around engaging dads, then they can't really kind of move to putting other things in place to support that. So I think the challenges of addressing MCH services in rural communities, it needs to be lifted up more and more, so that the division can pay more attention to it even for the next round.
One thing that I will mention too, in just speaking of working closely with your project officer and the support that we have received throughout our 3, going into our 4th year, we weren't far into our Healthy Start work, and COVID did hit. And we had an LCSW that was specific to one county. And really, through our application, like, they were really to see the residents of that county. But we saw the need in our other counties, but they didn't have a provider to really address those needs under the Healthy Start umbrella. So, our partner sites and the IRHA teams, talked about this need across all of our counties, took it to our project officer, and, through several discussions, it was decided, if, your LCSW and your hospital's in agreement and they have the capacity, and you want to extend her services, especially during this time of COVID, by all means, whatever you need to do to help your participants. And the LCSW at the time absolutely did, and was able to assist participants across all 4 counties, not just solely the county that she originally planned on serving.
That's a great example, Jonah. Thanks so much for sharing that. And let's move to the next strategy here. And Ken, I want to pull you in on this one, but this came up around connecting organizations that have gained the trust of the community with other organizations that may be national or larger in scope. And anything to add here from your point of view?
Yeah, and I think there is this is the asset-based community development. So really looking into your community with organizations that actually have great relationships with the community, and then really partnerships come to mind here. So really connecting those organizations that have the trust of the community and to larger, well-funded organizations, which is a big shift. And so it's hard to do that, but I think focus on that as a strategy is important, because if you can bring your community together and a bunch of organizations together that have good relationships with the community, then that can sometimes be a great place to kind of advocate for larger resources to make larger connections with the larger organizations. So I think there's tremendous opportunities there for partnerships with those organizations that would be willing to lend their relationship with the community to you all. And that, not sometimes, but many times that works better, because if I trust that organization that's been good to us as a community, I would listen to them before I listen to you. So again, if you can broker that relationship, it just makes it easier to build the relationship with the larger organization. So very important piece here, I think, too, because we need those resources of the larger organizations that'll support the smaller ones in addition to the community. So it could work out really well.
Great, and I think we can transition to the next strategy as well. So this was a big one. So providing culturally competent or care while not duplicating services, right? So when we think about congruent or culturally competent care, we're talking about care that respects diversity in the patient population and cultural factors that can affect health and healthcare, such as language, communication styles, beliefs, attitudes, behaviors. And we know how important this is in all communities, but especially I feel like in rural communities where it's, each one is unique. And like we were talking about with the providers, I think connect here too in terms of strategies, right? So when we were talking about having providers come from the community and come back to serve the community, really being ingrained and understanding the belief systems, the values, the traditions, practices of those communities. Anyone else want to talk more about this?
I was just definitely going to jump in on this because some folks may be on the call that's from my generation, older, but you may recall in the 70s and 80s, especially 80s during the crack epidemic, this culturally congruent care came up a lot there, because then we heard researchers demonstrating that people really wanted to be served by, connected with those folks that look like them, not only that look like them, but understood their culture and then their experience. And that's why this piece came up so much, and I was just intrigued when it came up in the expert meeting, because it's true, many decades later, this is emerging even more, because that also helps build trust. If I kind of know you understand what I'm going through. And so as Nikki was saying, specifically in a rural community, it's so challenging. And so I want to be able to trust the person in front of me. So this emphasis on having culturally congruent, competent care is really, really very important here. And I think it needs to be lifted up more, because it's coming up more and more. And I just wanted to emphasize that. And one thing I've learned recently, for example, and some of the historical impact of racism and how it plays out in rural communities, people don't like to talk about it, but in Alabama, up until 2018, you all, they were still allowed to arrest women practicing midwifery. Up until 2018, that's just 4 years ago. And it's amazing, because so when you know the history of these communities and you understand the disparities even more, we understand why they aren't people of color that are in places and spaces serving their own community. It helps you understand a lot more. But again, that's in Alabama. up until 2018, if you practice midwifery without being credentialed the way they say, you could actually be put in jail. It just blows my mind to even say it again today. But again, there are other things like that that are really, really evident in rural communities and some of the historical aspects of the people and the communities that live there. So I think it's important to understand those. Another reason why having that CAN is important, because these are issues, long-standing issues that need to be addressed. And I think this is a great time in our country to address them now that people are talking more about the impacts of racism in these communities.
Yeah, and Ken, one of the populations that we haven't spoken about too much here, but definitely came up in the expert meeting, is the tribal communities that some Healthy Start grantees serve, and the Native American, Alaskan Native populations. And we know, right, that this and respecting traditions and the different beliefs and just structures, family structure, across the board, right, in terms of working in those communities. So I don't know if anyone else wants to talk more about that as well. What do you think about this?
I'll just mention with our population that I talked about earlier with undocumented participants, a lot in the immigrants, a lot of them don't have the same concept of time as we do. So we have, appointments scheduled. Our clinical staff has appointments scheduled. But a lot of times, their whole day has turned upside down because a bus of our Haitian population comes to the clinic, and they come in and they expect care at that time. That's their culture. And I feel like our team does a really good job of always figuring it out, working them in, figuring it out, even though you try to explain appointments, and that's how our communities work. At the same time, they know they're there because they need our services, and they do a wonderful job of just helping them when they arrive and doing the best they can with their scheduling.
Gentlemen, that speaks to, again, and I've seen this, where practice kind of shifts how they do business, right? And so if that's your community, isn't it wonderful to think about adapting to your community where you have more time in between appointments, knowing your population? And so your front person staff won't have to have an attitude when someone shows up late, because we know that some things happen, take you longer, and that you still feel welcomed and a part of an environment, as opposed to, oh, client, you've messed the whole day up because you've come in late, or we're not going to see you today because of this. And so I've seen that across Healthy Start in certain communities too, when the actual environment shifts to adapt to the community that it's serving. And how wonderful is that is for you and the community to feel, oh, wow, they see me, they understand, and it makes you feel more connected. And again, building up that trust. So that's a great, great example, an opportunity where we can do more, I think, as we move forward, becoming more adaptable to our communities.
Great, and let's go to our last strategy. I think this is our last one in here for you all. And so, yeah, this one was around advocating for sustainability to be embedded in the programs that are implemented in rural communities. And I know in the expert meeting, we got into a bit of a discussion around this, right, in terms of like the flavor of the month, or a new program being piloted or launched, and the ability to sustain that long term in rural communities, and some of the challenges around that. So Jonah or Ken, Alexis, don't know if anyone wants to speak here on that topic as well.
Alexis, I know that Cynthia is not here, but I know her very well. And Cynthia and I have worked on sustainability within Healthy Start for decades now, because she is, as many may know, Cynthia is awesome when it comes to sustainability. And as Alexis mentioned, they have money coming from every direction because she's an advocate for her community, and they're able to do more beyond Healthy Start because of those resources that have come through. And so one of the things that Cynthia and I talk a lot about, and I talk with Healthy Start communities about, and that is really identifying those essential elements in your Healthy Start program that are really, really working. So if you couldn't get your whole program like funded to sustain if you lost your federal funding, what are pieces of it that you can begin to market early? And I think in the rural community, that's even a greater opportunity, because there may be some things that are happening specifically in your local area that you want to lift up and say, if I had just a little support around this particular activity that's really showing some great results, you can find people that'll be willing to support those pieces. If it's a transportation, but you've just figured out having tokens or having a bus service has really made the difference, then you can begin to advocate to funders, hey, if you can just give us a bus that we can purchase and be sustained for you, that will help and have this great impact. So I think, again, looking at what you're doing, looking at those activities that are really having great impact, and lifting up what's working, because people don't know, but when you can lift up, hey, this works in our community, then you begin to market that. And I will just point to Cynthia and many others, but Cynthia is a great person to also look at if you want to market a certain aspect of your program. She's just really, really good at that. And Alexis, you've been there a short time, but I'm sure you're seeing all this around you, but she'll be great to follow up with if folks are interested in how do you market certain pieces. And then again, I think of you, Jonah, and the stuff that you're doing. There are these elements of what you're doing that certainly, if you had to, you can go to different funders and say, hey, this piece is really working well. We're supporting our patient navigators with this piece. So different ways of looking at your program that way and thinking of pieces that can be sustained. So, but I'll kick it to either of you as well.
I think one of our biggest aspects that really helps our Healthy Start clients is the fact that we do have a bus and we do have a driver that can transport patients back and forth to doctors and things, because our hospital in Dunklin County, Dunklin County is gone. So we only have one hospital in the surrounding area, and that's over 50 miles for some of our counties. So it's very difficult for them to get the help that they need. So it's like a fighting battle, and Miss Dean is amazing at trying to get around that. So I like the point that you made, that using other aspects to help other things is a great way to get around obstacles.
That's great. Thanks so much, Alexis. All right, so I think we are wrapping up the strategies section. And so I'm going to turn it over to our colleague Sharon to talk a little bit more about some potential partnerships and resources outside of what we've already been talking about and what Jonah and Alexis have been so gracious to share with you from their experiences.
Thanks, Nikki. Next slide, please. So I was able to pull about 3 resources from different government organizations. So the first one is a Rural Health Resource Guide from HRSA's Federal Office of Rural Health Policy. So I've linked here in the slides. The first is a guide for rural healthcare collaboration and coordination. So it just describes how rural hospitals, community health centers, local public health departments, and other stakeholders can work together to assess and address their rural communities' health needs. So I think this speaks to, connect that partnership with smaller organizations and larger organizations. The next one is the Rural Health Information Hub. And this is the nation's rural health information source. And it offers a library of resources, coverage of rural issues, state guides, toolkits, program models, and more. And you can also get customized assistance by phone or email. The next is the Rural Community Health Gateway, which can help build effective community health programs and improve services. And the resources are chosen for effectiveness and adaptability, and they're drawn from programs with a strong history of service and community success. So I think with the work that you all are doing right now, which is extremely impactful, this can help in, improving your programs and services for the years to come. Next slide. The next one is the Rural Health Research Gateway. This is an online library of research and expertise. It's free to use and provides access to the work of all 10 federally funded rural health research centers and policy analysis initiatives. And the last one is the resource guide for new applicants and grantees. So this just provides new applicants and grantees with an array of relevant resources, tools, and services organized by topic area to help assist in the implementation and sustainability of rural health projects, organizations, and networks. So especially lifting up that sustainability aspect for projects. And then some other federal resources are a rural action plan, health IT, telehealth startup and resource guide, and an FCC rural care program. Next slide, please. The next resources are from the Centers for Medicare and Medicaid Services. The first is a rural crosswalk, CMS flexibilities to fight COVID-19. As we're all aware, we're still not over or through this pandemic and the fight continues. So this highlights COVID-19 related provisions that CMS issued by regulation or waiver that impact rural health clinics, federally qualified health centers, critical access hospitals, rural acute care PPS hospitals, and or skilled nursing facilities, and just describes the significance for these rural providers. And then Rural Health Clinic Center serves as a hub for information related to the clinics, including payment and billing policies, educational resources, policy regulations, and billing or payment related fact sheets. I know earlier it was mentioned, helping communities connect them to, insurance. And I think it's important to be aware of this information as you work with your communities to get them access to healthcare. And then the next one is federally qualified health centers. So the CMS Federally Qualified Health Centers Center serves as a hub for information related to FQHCs, including payment and billing policies. So the same thing as the last one, just, being aware and having that information as you serve your community. Next slide. The next one is Connected Care, the chronic care management resource. And this is from the CMS Office of Minority Health in partnership with the Federal Office of Rural Health Policy. And it was implemented as a public education campaign to inform healthcare professionals and consumers about the benefits of chronic care management services. And this has a special focus on encouraging participation by underserved rural populations and racial and ethnic minority populations. And I know this covers the populations that you're all serving. And the next one is the Quality Payment Program. So clinicians in small practices, including those in rural locations, health professional shortage areas, and medically underserved areas are a vital part of the healthcare system. And CMS provides flexible options to help you actively participate in the Quality Payment Program. So I think even if this is not information that you can use as your program, this may be information that you can connect healthcare providers to. And the last one is the CMS Innovation Center, which supports the development and testing of innovative healthcare payment and service delivery models, which includes several models relevant for rural communities. Next slide. The last resource is from the Cecil G. Shep Center for Health Services Research, which is located at UNC, the University of North Carolina. And this is the NC Rural Health Research Program. And it seeks to address problems in rural healthcare delivery through basic research, policy relevant analyses, geographic and graphical presentation of data, and the dissemination of information to organizations and individuals who can use the information for policy or administrative purposes to address complex social issues affecting rural populations. I know in this arena of advocating for funding for programs, it's really important to have the stats and the data to support why the work that you're doing is really important. And so the NC Rural Health Research Program can provide those resources through the Rural Health Research Gateway, the Rural Health Research Recaps. You can get research alerts so that you're always aware of any new research that's coming up related to rural communities, access to research publications, to other research centers, and a dissemination toolkit. Next slide, please. And so I hope you will find those resources useful, and I know they're like research and data heavy, but I really think that it's important to have that information and just to be able to be aware of the issues that your communities may be going through, and also being aware of other organizations that are doing the same work. So I will turn it over to Ken for next steps as we discuss themes and ideas to explore in the future.
Thanks so much, Sharon. So let's do what the slide says and just take a pause to digest. And I know folks have been mostly in listen mode, but again, it was just important to share with you what we learned from those experts that we convened, our experts in addition to Jonah and Cynthia, again, just to hear like what were the pressing issues in our rural communities. And that's the signal, really that kind of alarm to just raise awareness around these issues that impact our ability to serve women and children in these areas. And so a lot here, and just discussing the challenges and strategies. And I'm sure some things were said today and you've taken some notes, but some good strategies were shared. Again, our thanks to Jonah and Alexis and Cynthia for being part of both sessions, and in fact, and really lifting up these strategies. So I hope you take away some good things. And if you have any thoughts or comments, feel free to drop those in the chat now. All right, but just take it all in because it was quite a bit. I know that on a personal note, for me, I was really excited in that first session just to hear from everyone in the discussion and really to understand better what's happening in some of our rural communities. Because I will tell you, in the history of Healthy Start, there hasn't been this opportunity to really have space in place to really discuss our rural communities and our Healthy Start programs there. So I hope that each of you that are on the call and even our remaining rural sites are getting the support that they need. Because again, we've emphasized throughout today's call the intentionality behind the Bureau and the division to support our grantees. And we've certainly are trying to do a great job in supporting you. So if there are any needs, thoughts you have, want to explore anything, then we're here as a TA center to support you in any way that we can, and even give you access to some of those experts out there in the field. So thank you for hanging out with us for those parts of our session. Let's go to the next slide. And so, am I still talking here, Nikki? Is that fine to keep going?
You can go in. Yeah, keep going.
Okay. So again, so just think about what are your reactions to the ideas that were generated today. Again, we talked about some key challenges and strategies, but what do you think about the change ideas? Because the idea is to have a discussion to think about ideas and strategies to move things forward. So what do you think about the change ideas and strategies that we've discussed today? Anything resonate for you, or the thoughts that may have come to you? We want you to feel free to share your thoughts, ideas, and reflections on those things we've shared today. So again, poll everywhere is up. You can access by the top line, going to the actual site, or just using your phone to text Healthy Start 428-222-2333. And let's see if there are any thoughts there as we get ready to wrap up today. We would love to hear, share any thoughts that you may have after today. Even if you have questions, I think that's important. If you have questions, then ask those as well.
Collaboration is key. Yeah.
Yeah, I share a quick story, Nikki. Don't be afraid or hesitant to think outside the box. Yes, share your ideas with PR. And that is some absolutely, because there are possibilities. And if you share, you don't know, but yes, don't be afraid or hesitant to think outside the box. But I was going to share a quick story when Ken Scarborough and I were going around the country doing trainings on the core adaptive model for fatherhood. I remember we were down in Mississippi and we were like traveling on a limited budget. So we were like two guys hiking up around the country. I felt like I was going through USA, rural USA. But when we got to Mississippi, we had our game plan. We knew kind of what we wanted to share. We had these thoughts and ideas on what people could do to encourage and support fatherhood work. But again, being in that rural area, we actually worked with the consortium there of that project. And there we learned so many things on this particular day that upset everything we had planned to say the next day. We're like, we can't recommend this or that because it doesn't even work here based on what we've heard from the community. And so he and I stayed up all night. We got like 2 hours of sleep a night, and we had to change all of our slides and recommendations to be more adaptive to the community and what people could do and how to work with the men in that community. And it was one of the most exciting times I've ever had in this work, because being there, being present, hearing people's voice, and then being able to come up with solutions together on how to really approach and address things. So it was really exciting. So I think, again, being there was great, but hearing the needs from the community's perspective really shifted everything that we were doing. And I think that's what's going to happen as we think about providing services to reach our women and children. So, but here we're seeing including the community as much as possible. And that is exactly what happened. I'm so glad we required that day 2 that they have their consortium members present, because we knew we need to talk to the people, and it made a big difference. So
I think your story was just illustrating all of these. This next one too, being willing to reassess the needs of the community and act upon them. So yeah, great story again.
It was like real time. It was wonderful.
Yeah.
And then they gave us good barbecue afterwards. So I was glad we did a good job and had some good barbecue.
Your reward for your late night.
Yes.
All right, great. Well, I think we'll wrap it up here. And Sharon, I think we may be turning it over to you for logistics as we head out of this webinar and talk about kind of what's next with this topic and this work.
Yes, so the first thing, as we like to do for all our webinars, we would just like to get your feedback, which is extremely valuable and will help us ensure that, future CIGNAL offerings address the needs that you have in your programs. So Denisha has entered the link into the chat, so please take some time to complete that and we would greatly appreciate it. Next slide, please. So as one of the next steps, task will take the ideas that have been generated during the CIGNAL expert call. And I think we even have more ideas that were generated during this call, and we'll create a summary artifact, which will be shared with the broader Healthy Start community. So we really thank you for your contributions to this conversation. And I really hope that the rural projects that were not able to be present during this webinar today will be able to take that information and apply it to their programs. Next slide. Another thing is that you can request one-on-one TA from our quality improvement advisor, Jane Taylor, and she can help your Healthy Start project further develop and test the change idea strategies that were discussed during this meeting. You can visit the EPIC website to submit a TA request by clicking the HS EPIC Center tab and selecting the Request Technical Assistance. Next slide. And if you have any further questions or would like to be connected to any other resources that we have, feel free to email us at healthystart@nhq.org. And again, we would like to thank you for joining us for this webinar and really engaging in this discussion that I know will be extremely useful to the work that you're doing. And I've been inspired just listening to the work that you're doing. Jonah, the mental and behavioral health access, and Alexis, your work during COVID-19 and just including the community to work together has been really inspiring. Ken and Nikki, I'll turn it over to you for any last words.
No, I'm pretty good. Like I said, I've shared earlier that I've been a part of Healthy Start for many, many years, and I do have a heart for the rural communities. I was born in the South in Memphis, Tennessee, and when we had a program there in Memphis, I was able to go down and do some work there, just again, witnessing the challenges that are in rural communities. And so I was really happy for this round of Healthy Start that they were focusing on gathering more Healthy Start communities in rural areas. And so the work that you all do, I know is really extremely difficult. And the individuals that are working with your projects are very passionate people, as we at the TA Center have met many through this cycle. And so again, we want to be as supportive as we can to your work because we know there are so many challenges that many don't understand as they implement a Healthy Start program. So again, we're here and look forward to supporting you in any way that we can. And so feel free to reach out to us if you have any need or a thought or an idea that you may have. We'd love to work with you. Nikki?
I think Ken and Sharon have really covered it all. Just thank you all for hanging out with us this afternoon, spending some time, and like they've already reiterated, just looking forward to continuing this conversation, continuing to support you as you do this work in your community. Thanks, everyone.